Good evening. Welcome, welcome, welcome to the 20-minute fashion distraction. I am Jackie Jenkins. You know what we do every Wednesday night. We talk total fashion. Wanted to start off by saying I'm the founder of Sophisticated Curations. We are an online content, commerce, and collaboration community for the savvy fashionista. So thank you for joining us. And as you have done all throughout 2020, we are looking forward to you being with us in 2021. So I say welcome to the new year. I missed you all last week. I'm excited that we're here this week. And I just want to give a quick shout out to my sorors of Delta Sigma Theta for our Founders Day today. I thank you all for the love that you show me and also all the love that you share in the community. And tonight, I'm really excited. For January, what we are focused on is what I'm calling living your best you. And the way we are going to live our best you is just really explore some different things and opportunities that we can do from our beautiful selves. And so tonight, I am excited to be here with Dr. Nia Banks, and I'm going to bring Dr. Banks on. Hi, Dr. Banks.
Hi, how are you, Jackie? How are you?
I am wonderful. I am wonderful. Thank you for being here. I'm a big fan of sharing with the audience who is with me, but making sure that they're on camera when we do it so that we can sing your praises. And so Dr. Banks is the founder of the Beaux Arts Institute of Plastic Surgery. And I just want to share a little bit about Dr. Banks. And actually, I see we have Karen here, Jan's here, my mom is here, and Leah's here. So thank you all for joining and tuning in. And so let me just share a little bit about Dr. Banks. Dr. Banks is a board certified plastic surgeon who received her surgical training from Johns Hopkins in Baltimore, where she completed her integrated residency in plastic and reconstructive surgery. And she was the first resident in her program. Congratulations, Dr. Banks. And dear to my heart, Dr. Banks has also worked in Paris, where she was a craniofacial fellow, where she provided constructive surgery for children that were dealing with congenital abnormalities. And Dr. Banks' specialties are breast and face. However, she is able to support all these. And I just want to just read a little bit more. I mean, it's interesting when often people shorten their bio. And one of the things that I want to do when I have guests on the show is really honor them and read their full bio. So I just want to take a little bit more and just brag on you a little bit, if that's okay, Dr. Banks. So Dr. Banks is the chief of plastic surgery at Doctors Community Hospital. She's a member of the American Society of Plastic Surgeons, a member of Alpha Omega Alpha Medical Honor Society, and a fellow of the American College of Surgery. And she is a contributing author. And I can say this personally, she is an amazing individual that just has a wonderful spirit. And I am sure that we're going to have a great conversation tonight. So let's jump into it. What inspired you to actually want to work in the field of plastic surgery? And I think Dr. Banks just froze. Wait a minute. Hold on. Yeah, I think Dr. Banks just froze. Give us 1 minute. Okay, Dr. Banks is back.
I'm back. Sorry about that. That was definitely on my end. What inspired me to go into plastic surgery? Well, there was several things. I always was interested in surgery. I like that you can put someone to sleep and wake them up and make some life-changing changes. I like that amount of control and how we care for patients. And I also like the artistry with plastic surgery. I had originally intended to go into architecture, and through some circuitous route ended up going to medical school. And so it ended up that I ended up doing architecture after all. It was just with the body and not with buildings. So it's a lot of fun. There's a lot of instant gratification. There's a lot of artistry. Plastic surgery is very competitive, but when you actually are working, it's actually more important that you have some artistic talent.
I love it. Now I'm making the connection with the Beaux Arts. That is actually very fascinating.
Got it.
Yeah, that is wonderful.
Architecture style, that's where that came from.
Yeah. No, and if you to your point, it's art, but art of the actual body. So, can you share with our audience of dynamic individuals that already have amazing appearance, thoughts, this and that, but maybe thinking about plastic surgery? Can you share what types of surgeries are available to assist individuals? And when might someone even think about doing plastic surgery?
Well, so when you think about what Beaux Arts architecture is, it's actually a style of architecture where I'm supposed to modify my style based on what the client needs. That's what the Beaux Arts style of architecture does. And that's similar to what plastic surgery should do. We are supposed to fit it customly for each person. And I think that's why the surgeon that you choose is so important, because each solution should be a custom solution. Everyone shouldn't have the same lip, shouldn't have the same nose, shouldn't have the same eyelids. So really it's a custom fit solution. And we're really trying to, in most cases, for something that already was, not change who you are or change your features or.
Okay. Well, 1 minute. We are having a slight technical difficulty, but I see a question in the audience. I see Judith is here, and Van is here as well. My sister Jan. Hi, guys. And so Dr. Banks is going to jump back on. Can you, because we lost you midway through, and you were making such a great point about having the service be custom to the individual.
You're coming back. Okay, there you are.
Okay. I was just saying, can you just maybe, we lost you towards the end, and you were making a great point about having the service be custom to you, the individual.
Can you say that again, Jackie?
You made a great point before you cut out. And can you share about the service being custom to you, the individual, and why that's so important?
Because I think we really, most people who come to me, especially the mature woman, wants to be themselves. They don't want to be somebody else. They want to
Mm-hmm.
be a better version of themselves. They have a lot of confidence. They know who they are. They're comfortable with who they are. They love who they are. They're very accomplished. And they're just trying to maintain that edge that comes when you feel good about yourself. When you feel good about yourself and your appearance, you have more to give. You're more positive. You have more energy. You have more confidence. And that's what they're looking for when they come. They're not looking to change who they are or gain something they don't have. They're looking to hold on to something that's worked well for them in the past. And that sometimes is our appearance. So we're often talking about restoring volume that is lost. We're often talking about removing skin that slid down from someplace, like the eyelid skin slides down, makes it hard to put your eyelid makeup on. That's one of the earliest things that happen. Our cheeks deflate as we get older because we lose bone structure and we lose cheek mass. We're looking to put something back the way it was. Everyone's lips get thinner as we get older. We're losing some bony support for the lips. The lips get thinner. We can't put our makeup on, our lipstick on properly. Those are the things that women tend to come in for, looking for a solution, not trying to be someone else or bring in a picture that says, I want to look like this person. No, I used to have beautiful full lips, and now I seem to have lost some volume. Can you help me with that?
Okay. Okay. Can you, there's a question, and actually, this is a great question. There's a question in the chat of if you've had one breast reduction, can you have another?
Yeah, you can. You certainly can.
Okay. Okay. All right. And I see Tori's here. Hey, Tori.
Uh,
Um, what's your most popular procedure that you're finding in individuals coming in for?
Invasive procedure, probably liposuction.
Okay.
Non-invasive procedure, fillers. I
Okay.
would say that in a week, we probably do the same number of each. Fillers are like spackle. They add volume. They fill in cracks and add volume. The improvement you see is instantaneous. It's a little different than Botox. Botox is something that stills muscles, so it doesn't create wrinkles. It stops folding of skin when the
Okay.
muscles move. Botox stops the muscles. Fillers fill in the skin, fill up the cheeks, fill in the line. We tend to use Botox up here and fillers down here in general. Um,
Okay.
in general, liposuction is the most common invasive procedure because as we get older, we often have areas of stubborn fat. We have hormonal changes, age changes, It doesn't have to be menopause. Just with age, our metabolism changes. We get fat. That's much, much harder to get rid of. And we could do liposuction to remove, contour, whittle down areas of stubborn fat. Like when your weight's stable, you've done everything you could do, you've exercised, your diet is proper, and you've got this stubborn area, then that's when you call the plastic surgeon.
That is very fascinating. And actually, I'm not the only person that was intrigued by the fact that you studied architecture and to plastic surgery. So there's just definitely a wonderful connection there. So this, and we all want to talk a little bit about fashion, and I wanted to touch on, and I've had a chance to see your Instagram, and to see some of the styles that you model for Miss Tori Sudan. Can you share what is that fabulous item in your wardrobe that makes you feel like the absolute rock star beyond, who you are?
So it's fitting that Tori, because Tori makes fabulous boots, and I'm a boot person, so I'm all about my boots and my jackets. So for me, I have a pair of camper boots that are these mismatched twin boots. They did a series of these like 15 years ago, where the boots are not exactly the same.
Okay.
And they're like the worst shade of lime green and cream and black. But whenever I wear them, I feel like I'm a superstar. I feel like I'm a superhero. In fact, when I wear them to the office, they call me Captain Save a Breast.
Oh my goodness, I love that.
I've gotten them resold a couple times over the last 15 years, and I still love to wear them. They're my rain boots.
Oh, that is fabulous. That is fabulous. And you touched on one of the things that we talk a lot about here is shopping your closet. And to shop your closet, it is key to think about resoling, redoing. The rees are definitely an important part of that.
I resold it and lowered the heel.
Yeah. Oh, so I'm not the
Tori
only
knows
one.
I had trouble with the high heels. So Tori has several pairs of boots that I love, but I'm struggling with a 3-inch heel. She's helping me.
Okay. I see here's a question. Actually, there's a question on, does it make sense for African Americans to, plastic surgeons for, the question is around rhinoplasty. And does it make sense to actually go to a surgeon to have that particular situation addressed?
I think so. I mean, it depends on what your concern is. If it concerns you, it's definitely worth talking about. I think that's definitely an area of plastic surgery that's been very stigmatized. But I would say that it's very similar to, in some communities, breast reduction. In some communities, it could be, you don't get circumcised, like whatever it is, it's up to you. If it bothers you, then it's worth addressing. And it certainly can be addressed in a way that is culturally appropriate. And again, this is not about trying to give you a nose that is not an African American nose, or not an Indian nose, or not a Caucasian nose, or not an Asian nose. It's really about making sure that the face is balanced. So in plastic surgery, we have done a lot of studies about what's considered facial harmony, or what's considered attractive. And it's been done across cultures. It's been done in Iranian cultures, African cultures, Caucasian cultures, American cultures, South American cultures. It's been done across cultures. And the commonality in what we find attractive are certain ratios in the face. It's not a certain nose or a certain lip or a certain eye. It's ratios in the face. So if your nose or lips or your eyes are outside of that ratio, it may be considered unattractive to the untrained eye. Doesn't have to be a trained eye, just in general. It's just like in nature, we tend to find things that are symmetric to be very attractive. And it's the same thing with faces. We find symmetry attractive. We find balance attractive. So in the face, we talk about the golden ratio in nature. In the face, there's also this golden ratio. And if things are out of balance, it looks a little bit off. And so when someone looks at you, you might not want the first thing they see to be one feature. You want them to see the whole thing.
Okay.
And so, if we're looking at a nose and we say that, typically the width of the nose should be the distance between the eyes and things like that. We're just trying to get things in balance. So if you feel like it's out of balance, that would be a good reason to ask someone what can be done to make it feel, if it's bothering you, more in balance.
That is wonderful. A lovely comment around facial harmony and the fact that math is everywhere. Thank you, Leah.
Yeah.
You're so right.
Mhm.
Dr. Banks, can you talk a little bit about your spa and where people can find you?
So the spa is in Baltimore City, the Art of Balance Wellness Spa. This is my latest venture. It's a co-venture with a psychiatrist. I'm a plastic surgeon. You can see how they might go hand in hand. We also provide spa experiences. We do massages, hydrofacials. We do medically supervised weight loss, as well as liposuction, Botox, and fillers. So it's all in one place under one roof. It's located in the Ritz-Carlton Residences in Baltimore City. The private practice is Beaux Institute, and that's in Lanham, Maryland. That's strictly plastic surgery. And then, of course, you can follow us on Instagram, Dr. Nia Banks or Art of Balance Spa.
That is wonderful. Oh, once again, you're doing some great combinations here. I love the combination of psychiatry and the spa, like all things that, back to your point of harmony, that we need to have a better balance in ourselves. So that's amazing.
It all goes together.
Yeah, and it is, even as I was listening to you, I was just thinking about in fashion, there is a certain amount of balance in terms of selections of, tops and bottoms, proportions. But it's interesting. So now I would look at faces very different
Yeah.
in terms of proportions and how to actually think about that. So what are some of the alternatives to Botox? That's a question that I'm seeing that one could consider.
There's a couple of different medications that all do pretty much the same thing. So there's Botox, there's Dysport, and there's also another one called Janu, which is from Korea, but that seems to work a little bit longer. But they're pretty much all the same thing in that they help paralyze muscles, they keep the muscles from moving, and they do that for 3 to 4 months. This new one may last a little bit longer, but that's what we do to kind of smooth out the dynamic wrinkles. There's not really another way to do that. For the glabella, this area here in between the eyes, we can pull the nerve out of the muscle, and that's kind of permanent. When you do an eye lift, that can be done, a denervation of the corrugator muscle to slow this muscle down permanently. But there's not another option to Botox.
Okay. And when you say slow the muscle down, is that to keep the movement or the creasing? Is that what you're referring to?
So we want to stop the creasing. We want to stop the movement either temporarily with Botox or Dysport or permanently by denervating the muscle.
Wonderful. Wonderful. And so I guess as we're coming to closing, and it's so interesting because 20 minutes just always flies by. And I so appreciate the insight that you're sharing around a topic that, quite honestly, people don't really talk about. And that was one of the things that you and I kind of off camera talked about, is just some of the stigmatism, but also just some of the privacy. And I really like the point that you made about it can be as private as you want. It needs to be just feel good to you.
Yep, absolutely. And I think that, I think our privacy is important, it's paramount, but at the same time, we have to be very careful that we support women who have decided to have plastic surgery. One of the dangerous things in our communities, we have a lot of women who travel outside the country or outside the state to get procedures, and they don't want to tell anyone they have anything done. So they don't get adequate aftercare. There's no one to support them in their recovery. And that just makes me sad. And so if someone has decided to do something to empower themselves, I do want us to be supportive.
Sure. No, that's a wonderful point. Thank you. And I'm just going to do one more quick scan to see if there are any questions, because I think, to your point, the power in these conversations is really having the information. Absolutely. And a part of what I'm hoping that we get to do through these conversations is to have these discussions, even though fashion may be the backdrop, they're part of our overall lives. So I just want to see if there are any questions. There's quite a few. You should look at the chat later. Thank you for the information. That's always helpful. Wonderful. And can you just share one more time where your spa is located?
It's in Baltimore, Maryland, and we're in the Inner Harbor, so right around the water in Baltimore. We're located inside the Ritz-Carlton Residences in Baltimore, so we're right across from the Visionary Art Museum, right behind Rusty Scupper, right on the south side of the city. So easy entrance from 95 if you're coming from the south or the north, right off 95.
Wonderful. Well, Dr. Banks, I like to say thank you for this insightful information and just also for making the time. I mean, there are things that we just can't get back in time is one of them. And so really appreciate you taking the time to be on the 20-minute fashion distraction, but also just to really share some really insightful information for our audience. Thank you.
Anytime. Thank you, Jackie. Thanks for having me. And thanks for
Absolutely. And Tori, thank you for the introduction to my wonderful audience. And I see Courtney's here and Claudia's here as well. I want to say thank you all for tuning in on Wednesday nights. I know you could be several other places, but you come back. And so I'm really grateful. Next week, because it's a big week on big day on the 20th, we will not do the fashion distraction, but I will see you the following week. Everybody be safe, and I'll see you on the 27th.
Bye.
Thanks again. Hold on for a minute, Dr. Thanks.